Hi, good evening, everyone. Thank you for joining us. We're here tonight for the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer. I'll be joined here in just a minute by my colleague and co-host, Dr. Kelly Kam. We're both members of the Health Research Institute here at Michigan Tech University. We want to welcome all of our viewers watching tonight on Zoom, all of those tuning in on social media through Facebook Live, and all the listeners out there on 97.7 The Wolf. It's great to have you with us. Tonight is our 8th town hall in a series of 12 that we're having. First, I need to recognize our sponsors for tonight, which include the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, and the Physiological Society. We also want to recognize again our presenting series sponsor, which is UP Health System Portage. The Town Hall series is organized by the Health Research Institute, along with support from the Center for Educational Outreach. Tonight, we're going to hear from their director, Cassie Tafta-Munoz. The mission of the Health Research Institute is to support health-focused education and training for students, research for faculty, and also to engage in health-focused community outreach. The goal of the series is to increase our awareness about COVID-19 and how it impacts our health, the health of your family, friends, neighbors, and the health of our community. Our topic tonight will focus on how the COVID-19 pandemic is impacting our local schools and universities, and specifically teaching and learning for students. We have an exciting lineup tonight of educators here from, again, our local schools and universities. Each week, we focus on a different COVID-19 related topic. Last week, we talked about mental health. Other topics have included the role of public health in protecting the community, emergency protocols in place at our local healthcare systems and hospitals. We've also talked about the importance of staying physically active during the pandemic. Remember, if you missed any of our previous town halls, you can go to our website at mtu.edu/health-research. These are public and they're free, and you can go to the website and download those and watch those. Next, I want to bring in my colleague and co-host, Dr. Kelly Kam, who's our epidemiologist here on campus. So Kelly, great to be working with you tonight. And can you tell us what's on tap for our town hall?
Thanks. Hello, everybody. And yes, as Dr. Elmer mentioned, we're going to be talking about the impact of this pandemic on our education system. So many of us are either in university, have children in the K-12 systems, are teachers and current or past teachers within our community. And all of us have experienced the impact of this on our education, the way we deliver education. So we have George Stacaro, for the superintendent for Copper Country Intermediate School District, Mike Meyer, who's the director of the Center for Teaching and Learning here at Michigan Tech. We have two speakers from Finlandia University, Marnie Polke and Pam Brown. And finally, we have a student speaking to us, Lydia Savatsky, who is going to be speaking to us as the impact that she's experiencing as a tutor here at Michigan Tech.
I know I'm looking forward to the town hall tonight. Kelly, thanks for the introduction. I know you have just a couple of other public health updates here, one on sort of virus transmission and then one pertaining to the election coming up next week. So tell us a little bit more.
So absolutely. So we've been talking about the problem of misinformation throughout the series here. And this is just a demonstration of what the pandemic looks like in a state-by-state organization. So it took me a little bit to figure out with the setup of this. This is from Johns Hopkins Coronavirus Resource Center. It's actually mapped out kind of geographically. So with Michigan, we're kind of right there in the center. There's a bunch of different information that's showing here. This is the moving average number of the number of cases, and with a moving average here. And the really big thing to look at here is the darker the red, the faster the rate of increasing cases. So you can see that right now when this was published, South Dakota there is really an outlier. But most states here are experiencing some sort of pink or red, showing that we are on an increase. Those greenish and kind of blue ones are stable or a little bit on a decrease. So giving you just a little bit of a visual picture of what we're really experiencing across the nation, and reminding you that you should always double check your information and remember those ideas of how we can prevent spread of misinformation by not sharing things that we don't know to be true, and double checking your sources and getting your information from valid places. As a reminder, in terms of voting, so voting day is coming up next Tuesday, that try and make sure that you're voting safely if you're voting in person. And there are regulations, just to let everybody know, here in Michigan, and I would assume other states as well have that. If you happen to be under quarantine or in isolation over election day, there are systems in place to help you be able to vote. So I would recommend that you check out the michigan.gov, look for voting information. They will have voting information if you are under quarantine or under isolation, so that you can still cast your ballot. Thank you very much.
Thanks, Kelly. You're not quite off the hook yet. We have one more visual here for our viewers, and then for our listeners as well, we can walk them through it. But over the course of our town hall series, we've been compiling some useful websites for people as they're trying to find out the credible information. Can you just hit some of the high points here, some of these useful websites?
Sure. So again, with the misinformation, we're trying to provide a little bit of information of places that are going to have valid and reliable information. So certainly our government websites, whether you're looking at the state of Michigan, Centers for Disease Control and Prevention, or our local government with the Western UP Health Department. And wherever you're living, check out your local health department's website or your state website and look under whatever your Department of Health and Human Services are, your public health department. Globally, World Health Organization, as well as Johns Hopkins Coronavirus Resource Center, has a lot of good information. There's also information if you look at some of the scientific journals. The Lancet is another one that has a lot of good information. And certainly within different organizations, so our health system organizations, UP Health Systems Portage, Aspirus, as well as Upper Great Lakes, all have good information on their website. And if you're looking for particular information from a particular organization, such as Michigan Tech, if you look at our Flex website, that will have testing information and case numbers for our community. Copper Country Strong is for our 5-county region here in the Western UP, has lots of information, including a lot of resources that are available during this pandemic.
Okay. Thanks, Kelly. And we're going to learn of a new website tonight with the tech tutors, and one from a couple of weeks ago was the Up and Moving, upandmoving.org, providing resources to stay physically active during the pandemic. So we'll continue to add to this list over the next couple of weeks. Next, I have the pleasure to welcome Cassie Tefta-Munoz to the program to provide some opening remarks. Cassie is the director for the Center for Educational Outreach here at Michigan Tech University. And Cassie, I just want to thank you and your center for all the support in helping us organize the Town Hall series. So welcome to the program.
Great, thank you so much. We've really been happy to help bring this to life for the community. The Center for Educational Outreach, our mission really is to supplement learning both locally and across the state and nationally as well. We really specialize in hands-on application-based programming. A lot of that happens in schools, but a lot of it also happens out of schools. So we really just try to spark curiosity. And, the thing with the pandemic, as Dr. Kim mentioned earlier, many of us have had firsthand experience with the disruption from education loss and school closures, and emergency school and virtual school and distance education and all the other new buzzwords that have entered our lives in the last 8 months. But the pandemic is a pandemic after all. And so this has really been kind of a global crisis for education as well. The Organization for Economic Cooperation and Development came out with a study a month ago, and what they tried to do was to start looking at what is the economic impact of education loss around the world. And this is obviously a very, very preliminary study, but their findings are pretty somber. They were suggesting that students, even just remember a month ago that this study came out, certainly many of these disruptions continue, but students who've experienced education loss between March and September may earn 3% lower income over their entire lives. On a national scale, this could equate to 1.5% lower GDP for the remainder of this century. So we're really looking at very, very long-term impacts of this. And certainly there's other impacts as well. So the increase of screen time, I'm a parent, and that also includes the increase of screen distractions, right? It's not, more screen time is not always positive screen time. Socio-emotional impact, reduced socialization. And being here at Michigan Tech, we're certainly very familiar with the ambiguity that surrounds college these days. The college decision-making process has become a lot more difficult and burdensome for parents and for students as well. You know, students who were looking at colleges or are thinking of attending an institution over the next couple of years suddenly have questions about how to go about the process. And unfortunately, the support systems that are there to help those students in school with guidance counselors, a lot of that was simply not available in the spring, and a lot of that continues to be a challenge. So, you know, every public institution in the state right now has dropped testing requirements for admissions processes for the class of 2021. And so, you know, there's really been kind of a very, very wide impact of this, but it's not all bad news. You know, the thing about the pandemic is that it's really a global equalizer. It's exposing opportunity for educational reform as well. You know, we have always looked at education in sort of this transactional way where we, you know, deposit knowledge into students as they walk in the classroom. But over the last 15 or 20 years, students, you know, they go to the internet for knowledge. They go to the classroom for that relational piece instead. And so the thing about the individualized learning that comes about with virtual learning is that it is really a way that can meet students' needs better than we've been doing. So if anything, I know that we have a great lineup here tonight that we're going to dive a lot deeper into all of these topics. And I think that the positive note here is we have a great opportunity to shift our focus from regaining normalcy within education to really long-term innovating and kind of take advantage of the opportunities that we do have in front of us to redesign a whole system that works for our communities and for our globe.
Okay. Thank you, Cassie, for helping us get the town hall started tonight. We're going to move right into our first speaker panelist here. Want to welcome in George Stacaro. George is the superintendent for the Copper Country Intermediate School District. So George, great to have you on the town hall. And I know you're going to give us an update on how the pandemic is impacting K-12 students and teachers here. So George.
Thanks, Steve, for inviting me. What I did is I asked you to send me some questions because I'm not sure what the public wants to know. So we have a list of questions that we're going to go through, and hopefully that provides information that people want to hear. So one of the first questions I got asked was, what safety protocols have we put in place for students to keep them safe? And it's important to know that all schools had to do a return to learn plan before school started. And we know that there are 6 phases that Michigan has come up with. If we're in phase 1 through 3, we have to stay online. That's the only option we have. In phase 4, which we currently are, there are some very strict protocols regarding masking, cleaning, and social distancing and things like that that are absolutely required. If we go to phase 5, many of these are just highly recommended and not necessarily specifically required. I know the big issue has been the masking issue, the masking requirement, and we all know the Supreme Court had overruled the governor on some of her executive orders. But in Michigan, the Department of Health and Human Services have since issued their own orders, and it's important for the public to know that all schools legally must follow these orders. So right now, masks are required for all staff and students at all times, except for during lunch and when they're outside. Some of the other things that we are doing, though, is we are also cohorting classes to help minimize exposure. So those are some of the things that are going on right now. I was asked, what about the curriculum content, and has that been modified between face-to-face and online? And I thought that was a great question. Most schools offer face-to-face and online options for their families. It's very important to know that no matter which way we provide education, all the Michigan content standards must be still provided this year. I think at the end of last year was a little different. Everybody didn't know what to do that last marking period of last year, but starting this year, we are covering every Michigan content standard from day 1 all the way through the school year. Next question was, has the ISD had a plan? How do we plan ahead for the unknown? And I have been in education for 32 years, and I can honestly say the last 8 months have been the hardest I've ever experienced in my educational career, my teaching career. We're constantly dealing with the unknown. Things change in the instant. A good example is we all know that the Houghton County schools were shut down for 2 weeks. That came very fast to us, but we adapted and we did it. And we know that we're constantly dealing with either positive cases or quarantine issues. Another problem that we've been having is a lack of substitute teachers. As we know, Houghton Public Schools, Houghton Portage Township Schools, their high school was closed for 3 days right now. And that strictly was because they didn't have enough substitute teachers to handle the staff that they had that were out. So again, we're just constantly having to adapt, and we're working on that. One of the other questions was, what kind of guidance are we getting from the health department? One positive thing that has come out of this is the ISD has helped set up weekly meetings every week. All my local superintendents, the health department, the local hospitals, and the doctor's offices meet together for about 20 minutes to half an hour. We look at all the trends that are going on and ask questions from each other, and that helps us prepare for what we see may be coming down the road. So that constant communication has been extremely helpful for everybody. I was asked to comment a little bit about special education. How has that been affected in this pandemic? Well, you may or may not know that the ISD operates all the special education classrooms except for the resource rooms. We provide many other services like speech therapy, occupational therapy, teachers consultants for the autism, just to name a few. There's many more. All these services have continued to be delivered. Some families have chosen to not send their children to school, whether they're regular ed or special education students, but we still continue to work with those families and provide services the best we can. We do virtual therapy visits and have done some live streaming with students into their, from their homes into our classrooms. So we strive to make sure we still provide those services to those families. This was the toughest question for me. Any positive outcomes during the last several months? And as I told you how tough it's been, it was tough to come up with something positive during the last 8 months. But I would say the one thing that I'm the most impressed with is the school's ability to be creative in supporting students. There are schools who have been able to hold classes live online, and I think that's awesome, where students are able to take part of the class from their homes and interact with their fellow students who are live in the classroom. During the shutdown, many of my ISD providers were able to still meet one-on-one with students to provide them with the services they needed. There's still much to figure out. We're not saying we have it all figured out, by no means, but the school personnel and the families are working together to make it work the best we can. For years, teachers were dabbling and moving portions of their classes to virtual classrooms because of the constant changing between virtual and face-to-face. I think teachers are adapting their materials so everything is available to kids online. So then when it makes it easier if we have to shut down again. I have ISD consultants and coaches have found ways to deliver professional development to local teachers and that minimizes their efforts to have to come here to get that professional development. And then the last question for me is, what messages do I have for parents? Hang in there. We know that parents, students, and teachers are all doing their best. We know this isn't easy, but as long as we all work together, we'll get through this. Make sure to reach out to your child's teachers when you think that they need help. The teachers are there, the principals are there. We want to make this as successful as possible. If your child is remote learning, the one piece of advice I have for you is to create a routine and stick to that routine. Routines are very important. So those are the questions that were offered to me, and hopefully I've answered them. We'll wait for the next question from you.
Well, thank you, George. I am going to ask you a question here just to start off, and we'll come back with more questions. Can you just talk a little bit about how the pandemic is impacting the students and their development? So, for example, social skills, achievement, performance in the classroom. Can you just touch on that briefly?
That is a tough question. We have to do some testing ourselves. So we are going to be testing students right now to see where they are academically, and then we will test them again in the middle of the year and at the end of the year, so we can gauge that. I know that there's some school loss. There is some educational loss. I am confident that we will catch students up. Will we catch them all up in 1 year? Probably not if we're going to be closing down and changing things the background. But do I feel over the next 4 or 5 years that in the end, children will reach their full potential? Yes, I do.
Great, we appreciate it, George. We'll come back to you in a little bit. We're going to move on to our next speaker tonight. Just a reminder, if you are just joining us, you can send in questions 2 ways. You can use, if you're watching on Zoom here, you can send questions in using the Q&A button at the bottom. If you're out there listening or on Facebook Live or listening on 97.7 The Wolf, you can email those to us at townhall2020@mtu.edu. Our topic tonight is focused on how the COVID-19 pandemic is impacting our local schools and universities, teachers, and student learning. And remember, our town hall tonight is presented by UP Health System Portage. So with that, I have the pleasure to welcome in Mike Meyer next to the town hall. Mike is the director for the Center for Teaching and Learning here at Michigan Tech University. He also teaches in the physics department. So Mike, great to see you and welcome to the town hall.
Thanks, Steve. So I was asked to just kind of give a summary of, the story, the COVID story at Michigan Tech. Like many of the schools, we spent the spring kind of in a Band-Aid mode, trying to make sure that students and faculty were safe and able to continue to learn. This summer is really when we sort of started to make a concerted effort to adapt, knowing that things were not going to be the same for a while. And our summer work really consisted of 3 major things. One was figuring out how to set things up on campus so that students could be safe and continue to take classes, to think about what technology needed to evolve to so that students could learn both in person and remotely. And the biggest piece was we invested heavily in training our faculty. More than 400 Michigan Tech instructors spent anywhere from 6 hours to 10 weeks working really hard on coming up to speed in teaching remotely, teaching online. That major investment, I think, really has paid off this fall. In the spring, we asked our students, I felt like we came from a pretty good place to start with. We asked our students how things went in the spring, and even before we started this training, 50% of our instructors were named by somebody, by at least one student on campus, as having done an excellent job of pivoting. But this fall, the feedback that we've gotten from students is that with the training they got over the summer, things have been better, not the same as it was when they were face-to-face, but certainly even better than in the spring. So this fall, really, our priority has been to try and give students as much of a hands-on face-to-face experience as we could. And that's based on the fact that that's what we heard that students wanted. It's been interesting to watch the evolution of that in the first 8 weeks of the semester. I think what students imagined as face-to-face in labs, we've been able to live up to. But in a lot of the classrooms, especially bigger classrooms, the kind of collaboration that they were used to, where they could lean over a whiteboard together or lean over a notebook together, is just not possible with 6 foot distancing and everybody wearing masks. And so we really are finding ourselves leveraging a lot of the remote technology, a lot of synchronous classes through Zoom, a lot of conferencing. The students have, and faculty both have responded really well to that. And I think, again, I've been just like George, I've been really impressed with the creativity of faculty in finding ways to get students collaborating through those remote tools. I think we're still challenged by the fact that people don't make the connections the way they used to on campus. And that's probably our biggest challenge. We're working really hard to find ways to just help students find other students to study with and other students with common interests on campus. We also have are figuring out how to do things like give exams with integrity, but balancing student privacy against the need to sort of keep an eye on things. But I want to emphasize that this has been really interesting because we have students who are really being successful. I talked with a chemistry teacher who reported that his exam averages are higher than they've ever been in this semester. And then we have students that I'll acknowledge are really struggling because the very different mode of learning that's going on is not working for them. We've started our plans for spring semester, and we're still trying to maintain that face-to-face contact as much as we can in places that really need it. But we're starting to acknowledge that there certainly are places where remote learning is going to work just as well. We're trying to figure out how we balance very different, big differences in student workload because the nature of the learning sort of has put more on those students, I think, in some ways in terms of managing their time and managing staying organized and getting things in, but also for faculty because teaching is very different, takes different amounts of time to prepare and to meet students where they need to be met. And then to what Cassie said, we've started to realize that what's happening here is not a temporary situation, but a sort of leapfrog evolution in terms of how we're going to give tests from this point forward, how we're going to deliver instruction from this point forward. And we're starting to look seriously at which of these pieces have evolved in real positive ways. And I'll give you one quick example. Many of the instructors that I talk with say that they will probably do virtual office hours forever because they're finding that interaction through Zoom is much more convenient for students, especially on snowy days or things like that. And it works well for them as well. So there's some things that we're finding in some ways, if you're looking for a silver lining, that are going to really help us evolve. And I think that we're going to do better and better going forward.
Thank you, Mike. One question to start off, talk about the remote instruction, the remote technology. I know teachers and educators, sometimes we struggle engaging the students through that technology. Do you have any suggestions or advice for teachers and educators, and then also students as well, when they're on the other end? How can they be as engaged if they were, in other words, in the classroom, as they were in the classroom?
Sure. Yeah, that's the question of the hour, isn't it? We have instructors who are doing this in a variety of ways, from putting students in small groups like breakout rooms with a specific task, co-creating documents in shared documents like Google Docs or Google Sheets or Google Slides. We certainly have evolved our response systems. We use on campus a system called REEF that allows not only sort of multiple choice type questions, but short answer text questions. And what's called target questions. So I can send students an image and they can respond by pointing to the image. Mm-hmm. And even in my physics class of about 90 students, I can have real-time feedback. I probably do that 8 or 9 times in a 50-minute period. Students can vote on which homework problems they'd like to see worked in terms of getting help. And then I think there are also sort of lower tech interactive methods where we're asking students to do things like write things out, take a picture, send the work into our learning management system, and sort of short quizzes or quick assignments that aren't necessarily happening in class, but are extended into the sort of through our learning management system, throughout a 24-hour period around class. And taking advantage of those discussions and discussion boards and other things in that learning management system is an important part of the interactivity that just spreads things out beyond class.
Great, thank you, Mike. We'll come back in a little bit. I just want to remind our listeners out there on 97.7 The Wolf, if you would like to join us and see some of the visual content that we're presenting and see the speakers, if you simply go over to thewolf.com, you can click on one of 2 links. You can join us on Facebook Live or you can join us on Zoom. I know we also have a public health reminder. Halloween is coming up, so I want to bring back in Dr. Kelly Kam just really quickly here. Kelly, I know that you have some advice for how to stay safe during Halloween.
Yeah, so absolutely. So we can't cancel Halloween necessarily, but we can celebrate it in a little bit safer way. So a reminder that CDC does have some different levels of what are high risk and low risk activities. Door-to-door trick-or-treating is considered a higher risk activity. But if you do that, there are some things that we would just remind you to try and stay safe with. This particular PDF is from the Department of Health and Human Services from Michigan State. And so they have a bunch of different ideas in terms of you still should be wearing your face mask, keeping your distance, only trick or treat within your household group. Don't go to, if you are a homeowner, certainly don't be handing out candy if you are sick. There are different instructions and suggestions for how to be able to hand out candy safely. And certainly, as always, just remember those W's of keeping your distance, watch your distance, wash your hands, and wear a mask. This does get you out and walking around, which is always a good thing. Although maybe from a health perspective, picking up candy, having the candies, maybe not exactly the best thing in the world. But just some reminders to try and stay safe and keep your distance from everybody. And remember that indoor gatherings should be kept very small, ideally with just your within your little pod or your household group, because we are seeing quite a bit of spread within small household gatherings.
Great, thank you, Kelly. We're going to move on to our next speaker here. We actually have two from Finlandia University. I'm going to welcome in Marnie Polke and Pam Brown. Marnie is an assistant professor in the nursing program over at Finlandia, and Pam serves as the chair for the physical therapy assistant program. And so you guys will be doing a bit of a co-presentation here. So I will turn it over to Marnie and Pam. Thanks for being with us tonight.
Great, thank you, Steve. I'm going to jumpstart it and Pam will finish up for us. So yes, I'm a nursing instructor at the sophomore and junior level at Finlandia. And basically what I would like to share with is from a faculty perspective, but I will throw in a little bit of what I know from my students as well. I start out with the thought of attitude is everything. Really, we are fortunate to have a small campus. And I think in a way, COVID has reflected the strengths of being a small campus. We do support and stability during this chaotic time has been one of our main focuses, is just making sure our students and our faculty are well adept and equipped to be able to be resourceful with each other and for each other. We have put out a mental health day next week for our faculty and our staff, meaning everybody gets a day off. But Pam will tell you a little bit about that. It is unique to our nursing and our PTA programs. But anyway, we are very focused on trying to maintain a positive attitude throughout. We are, again, small with the numbers being low. We're watching our students closely and our faculty by doing our COVID tracking daily before we come to campus. Currently, I think we have 1 active case, 12 are in quarantine, and we have 30 recovered. So overall, I think we have a good handle on what's going on, and maintaining connection with each other has been forefront. Overall, our students, the impact on their learning because of COVID has had positives and negatives. I would say the positives in nursing specifically, we are critical thinkers. We have to perform under different types of levels of stress. So COVID in and of itself has enhanced our critical thinking. I would say, that's part of one of our things that we want to keep encouraging our students to maintain flexibility in their thought. But obviously there comes a negative side with the stress levels that also is part of challenging ourselves and learning under these conditions currently. So our learning has taken a hit with, having to quarantine or isolate from our learning abilities. And that is probably the most stressful part that we're experiencing during this time. For our instructors, really, I'd say overall our delivery of courses has had to be flexible as well, just as Michael was talking about preparing our faculty prior to jumping back into this fall semester after a very rough spring semester. And all the K through 12 teachers as well understand the challenges that we wanted to overcome when we went back to college and back to our K through 12 programs, because it was shocking to have to deal with switching from face-to-face instruction to virtual only. Currently, our instructors do everything between face-to-face, hybrid, meaning both face-to-face and virtual. It's kind of all over the place. So being very creative and energetic is important for our faculty. I would say also that unique to nursing in itself, our clinical opportunities have been shifting. I teach at UP Portage with the junior level. So clinicals there, we are also out in the community in different settings, different clinical sites like UGL, Upper Great Lakes, and other areas that we have to be very cautious about our interaction with each other, because we try to maintain our close pods of not spreading the virus, and we do all the things, all the mandates, mask wearing, glasses, covering our eyes, but we also have to have face-to-face instruction as much as possible for our clinical experience, because that's how we take care of people in nursing. We have to have our hands on, and all of the nurses and assistants out there that teach our students have been pivotal in our educating them, and we highly appreciate that effort that's put out there. So yes, the clinical opportunities, we've lost some, we've gained one or two here and there. We have a campus health center that's up and running, slowly getting its legs, and we're grateful to have a nurse practitioner on staff as a assistant professor as well, doing that with our students. Our community involvement and engagement with COVID has been interesting because we do a lot more hands-on. If it's not, it's more like a registration of our patients or clients with COVID testing. Our students were involved in the big mass testing back in October that was spearheaded by our health department and Michigan Tech. So we were grateful for that opportunity that gave our students another experience in a pandemic that may lead them into public health nurses, which is super important. We see the need for sure. I would say also our campus and community safety is huge. We were also involved in a Safe Open task force. We collaborated with Dr. Cam and Whitney Borowski and the health department. We just did a lot of different things to maintain some continuity, like connection between our campuses, and how were we going to do this. And within our own campus, we also worked very hard to make sure we were prepared for our students to return. And with that, we did our testing across the board for our students. We mandated quarantine as much as possible, or made safe opportunities for them to interact, maintain a positive attitude again during that time period until we knew their tests were negative. I would say also we're grateful for the Tech's COVID lab that helped us get up and running right away with our students, because that first week was all virtual when they came back to campus in the fall. And that is also going to happen in the end of our fall term at Thanksgiving. They will not come back. They will continue 2 weeks after Thanksgiving at home virtually for teaching, and then start a late spring term. And also our calendars changed with spring break, which is always a bummer not to have it, but our campus decided no spring break this year. So, overall, I think not just our nursing program, but our campus in general is doing very well. We have noticed the challenges in not having that connection when we see each other on campus. I think that's the big one. We feel a little bit isolated. We are small, so even taking a few people away seems like we're almost a deserted island at times. So we struggle with the social lack of seeing each other and the change in our routines of before the virus. But I think also we're very fortunate to have SISU in our FINU family and our community in general. We're all very supportive of each other. So I know Pam's excited to share about PTA, but I'll be willing to answer questions whenever you're ready.
We'll go ahead, Marnie, we'll pass it on to Pam, and we'll circle back with a question in just a few minutes.
Okay.
Hi. I just want to echo Marnie's talk of our students' resilience, and every student who's decided to come to college and experience it this year. You think about the seniors who missed out their graduations, huge monumental point in their student life, and yet they still chose to come to campuses. So that is where I applaud both Finlandia and Michigan Tech. Not every school started with face-to-face interactions and tried to preserve the college experience for those entering the college. However, we were wanting to make sure we acknowledge the fears of students and parents. How are we going to keep these students safe? And I think we did a very good job as Michigan Tech planning over the summer. Um, we personally in our department, like nursing, and I believe in every department, we looked at individual circumstances. We spent a lot of time looking at classroom spacing, putting up barriers. For our particular program, we made sure that we were maintaining the 6-foot distances like everybody else, but we were providing PPE. We do a lot of lab experiences just like nursing, so we aren't always able to maintain that 6-foot spacing. So how are we going to meet the challenges of keeping the students safe, but giving them the opportunity and the education they needed to be physical therapist assistants out in the field? So again, being creative, like Marnie said, and Mike said as well, it was super important. We take a lot of hand washing breaks. We make sure the masks are on. We reinforce the importance of the masks. I know all of us have been out in the community and seen people with the masks below the nose. I'm kind of tough on my students. I tell them if they're sitting in a classroom for 8 hours and can't keep a mask on, how am I supposed to send them to clinicals to keep patients safe? You know, we're constantly educating the students on the importance of not only their safety, but community safety and patient safety. And they are stepping up to the mark. They're realizing how important this is. And I'm really, really proud of them. We do a lot of sanitizing of desks. What we have done that's different is we are keeping our bubbles small. Again, we're having same lab partners, trying to pair up students if they live together already, make sure that they're partners, trying to make sure that if for some reason the unthinkable happens and somebody does test positive, keeping the impact as small as possible at our program level and the university level as well. We're also trying to limit the non-essential tasks. Do they actually have to have the hands-on to gain this experience, or is there a different way to deliver the information? So we've been very diligent in picking and choosing when we have to break those personal barriers and providing the students a safe opportunity to do this learning that has to be done. I think the biggest challenge, and I think all the educators can agree with this, something that we did not foresee was the amount of mandated quarantining that was going to happen. I will say I think, Marnie, in week 10 of our semester, and there have been only 5 days that we have had a full classroom. That has been a challenge. We are delivering the information virtually, but being a highly demonstrative and hands-on type of program, the students are experiencing some lack of experience. They are feeling left out of that type of education. So we have picked up extra time when the students come back from quarantine, staying after hours, giving them that hands-on experience they missed while they were on quarantine. So it has increased the instructor workload. We do find that Zoom has been a challenge. It is a great tool, definitely for lecture-based. It has been a godsend, but we also understand too that there is a difference than when we were using Zoom in March. I think one of the students said it best was in March, everybody was on the same playing field. Everybody was home. Everybody was getting the information the same way. Now we have some students in the classroom, some students on Zoom, and there's an inequity in delivery of the information is how they're feeling. So we're going to work over the break time to see how we can limit that and acknowledge the barriers that are occurring when students do have to be attending by Zoom and their classmates are in the classroom, to try to make it more of an equal playing field. Some of the biggest things that we've been really thrilled about, again, are our students' resilience. We couldn't do it without the positive attitudes, their willingness to be flexible, their willingness to trust us with new techniques, to try new things, and that's what's made it all possible. We're going to finish the semester on time. We have taken the opportunity to be proactive. I'm appreciative of my coworker. We loaded up the front half of the semester with our lab experiences when most of the campus was healthy. So when we started having those mandated quarantines, we were not so heavily dependent on the lab time. So just being flexible with the schedule, which is also a challenge for the students, has afforded them the ability to finish the semester on time and be prepared for clinicals. The other thing we didn't foresee happening was that we still have students from last year who were supposed to graduate in July. 2 of them are still finishing clinicals right now. So we're really having a group of 2 students to teach instead of the typical one cohort that we're used to. We are very blessed that Nicole Polakowski has worked very hard. All of our students do have clinical placements in November. But like Marnie said, every day we're holding our breath because we just never know what tomorrow's going to bring. So we do have a lot of positive things to be proud of. Our students are doing well. We do have challenges we plan to overcome. But I love the connections I've made here tonight and hearing the other speakers, and plan to have some idea sharing that I'm very excited about. So I want to thank everybody.
Thank you to Pam and Marnie. A question to start out with. Can you guys talk a little bit about how much guidance or maybe how much guidance you've received from your professional organizations or accrediting bodies? Are you left to kind of navigate on your own to figure out how to adapt to the pandemic, or are you getting more guidance because your programs are a little bit different from others that we've heard about? So could you comment on that?
I could do that, Marnie, if that's okay for
please do.
PTA.
Yep.
Right now, CAPTE did start, that's our National Accrediting Board, with some clearer guidelines back in March. And essentially, they are updating as we go along at this point, because all the states have different issues and different levels of COVID pandemic, mandating and things going on. We are actually now in charge of making a plan and making adjustments as needed, and then submitting those plans to CAPTE. There's still requirements we have to meet, but at the point of when there was so much diversity and so many different individual situations going on, they pretty much left it up to the universities to inform them how we were having to tackle our own individual issues, and then they would deal with that on an individual basis.
Okay, thanks, Pam. Just for the sake of time, I want to make sure that we get to our next, we have a student guest here, so we'll come back if we have enough time for questions. So next up, we have Lydia Savatsky. She's an undergraduate student here, majoring in math. She's also the president of a student club called Tech Tutors. So Lydia, it's great to have you with us tonight. We're looking forward to hearing a little bit more from the students' perspective, and also learning about Tech Tutors.
Yeah, thank you. So hi, everyone. My name is Lydia, and I'm a 4th year at Michigan Tech. And when the COVID-19 pandemic first began, I and many other college students were challenged to now figure out how to learn online. So my peers and I found ourselves trying to find the motivation to complete our assignments and succeed in our classes. And we realized that if us as college students were needing guidance in our learning, then K through 12 students must be needing just as much, if not more, guidance than us as college students. So we realized that as college students, we were kind of lucky, and that most of our work and assignments were already done online before the pandemic had even started, aside from lectures and labs. But for K through 12 students and teachers, they had to figure out how to assign and complete their homework online rather than inside of the classroom. And this realization is kind of what began Tech Tutors. So Tech Tutors is a formalizing Michigan Tech organization, and we try to provide K through 12 students with individualized support and educational opportunities. So our goal is to help K through 12 students learn online during the pandemic. And right now we have about 35 tutors that offer one-on-one and group session tutoring in a variety of subjects. And this organization is also a great opportunity for tech students because it encourages them to step outside of their comfort zone, become leaders, and give back during this pandemic. So if you would like to become a tutor, or if you would like to request tutoring, you can feel free to visit our website at techtutors-mtu.org. Or if you have any questions about Tech Tutors, you can email techtutors@mtu.edu.
Lydia, thanks. I had to unmute my microphone there, but thank you for that. That was fantastic, and I want to commend you and your fellow students for, starting this. Couple of quick questions for you. Is this just available to students and teachers here in the local area in the western part of the UP, across the UP, downstate, northern Wisconsin? Just tell us a little bit more about who's able to reach out to you for these services.
Yeah, so we are currently reaching out to schools around UP as well as some schools in Detroit. And this organization is kind of open to anyone who would like tutoring.
Okay. And then I'm going to ask you one more question here. There was a question that actually came in to the chat. Do you see any opportunities to collaborate with retired educators, saying that they could provide a service? And I saw George responded to one of the questions here, but those teachers that obviously want to help, they're passionate about education, but given the constraints, can't come into the schools.
Yeah, that is definitely something we could consider doing in the future. It is not something we are currently doing because as a Michigan Tech organization, we have to limit it to Michigan Tech students. But in the future, we could definitely start reaching out to those retired teachers who might want to help as well.
Okay. Thanks again, Lydia. I'm going to circle around here with a couple of questions for our panelists. The next question is for Mike. So Mike, this question, very good question here, thinking about, is there enough data yet out there to know how well students learn with remote learning or this hybrid or all of the different teaching sort of platforms that we're using right now, from your perspective?
So I'll say that, we're collecting data every day, right, at Michigan Tech. And I talk with a lot of instructors who come to the center, and it's a diverse answer. I mean, I don't think at this point we have a lot of students who were really good at face-to-face learning because that's what the bulk of their experience was. We have a lot of students who have adapted well and really like the remote learning and it's working well for them. We have students who are learning how to learn in that environment. And instructors, frankly, who are learning how to enable learning in that environment. So, one of the things we've talked about here in the center is that we're all first-year teachers this year in some ways. And so I think it's early to say one way or another, but I expect that the answer is going to be very much like it was with face-to-face, which is that there are students for whom this is a great mode and students for whom this is a challenge. Whether there's a substantial difference in terms of the percentages remains to be seen, as far as I can tell.
Okay. Next question is for George, who's the superintendent at Copper Country Intermediate School District. So George, the question is here is in regards to high-speed internet access. Can you just comment on that for those parents who have no access or limited access, or what, how is the school district working with those students who have reduced access to high-speed internet?
So that's a great question. We did a survey across the whole state of Michigan, and roughly 30% of our families do not have reliable internet service. And it's a struggle, and we are working with the legislature to hopefully start putting some more money into that, but that is no quick answer. I mean, we can't start burying cable and fixing this too fast. So what we are doing is we are buying hotspots. We are working with a lot of the AT&T, T-Mobile's, Verizon. In fact, here at the ISD, we just received, I think, like 40 hotspots that we can give out to our local schools to give out to families in need. So we are working with our local schools, and we're going to keep trying to get more of those to help families when we shut down that don't have the reliable access. Is it perfect? Absolutely not. But at least we're trying to come up with some solutions right now.
Okay. Thanks, George. Next question that came in here is for Marnie from the nursing program at Finlandia University. Marnie, can you tell us a little bit more about students' confidence in developing those really critical hands-on skills to work in healthcare? You mentioned, hey, some things are online or remote. Others were still in person following, the CDC guidelines. But how confident are students right now in their skills, given all the constraints that they're having to deal with?
There we go. Unmute. I would say, confidence is always best when they get it when they're face to face. So any hands-on clinical opportunities we can provide for our students in these programs and these specialty trainings is the best situation. So we are working very diligently and forward thinking on how we can keep them in clinical and keep them safe. I know in the spring when we had to completely shut it down, we were teaching virtual simulation type courses online, and it is just a whole different way to teach a student. And for our program, we have been granted the right to have 100% virtual, but all of us know that isn't the best way to learn. So we just continue to focus on maintaining as much face-to-face, hands-on for that confidence building, because it is the best way to build it, because you just never feel very, very sure until a patient gives you a compliment. You did a good job, and that's where it is. Or another nurse that's mentoring these students.
Okay, thanks, Marnie. Next question is for Lydia, our tech tutor from Michigan Tech. This question is asking, how young can the students be to work with the tech tutors? Is there an age limit? Can you just tell us more about that?
So the youngest that we have taught currently is second grade. So they can be as young as kindergarten. And our goal is just to help whoever needs it.
Okay. Next question is for Mike. I want to ask you, or we want to ask you this as the question came in. With everything being, more remote and online and hybrid, students have the potential possibly to cheat, or academic honesty here comes into play. What procedures are in place to at least check in on that and kind of monitor that, so to speak?
Good question. So it's certainly an issue that we are struggling with. There are a variety of ways that instructors are handling that. We do have a monitoring program. Our testing center actually offers or has proctors who can sit in and monitor on Zoom, but then we also have a program that uses some artificial intelligence and does some monitoring through video. But we've encouraged instructors to think about a lot of other ways to do this, from more different kinds of assessments that are more authentic. One of the things that I'm doing is I actually meet through Zoom for 10 minutes with each one of my students after an exam, and we talk through what happened on that exam. And that does two things. One is that I know it's their work because they have to explain what they did to me. But the other is that they get a chance to sort of debrief on what happened on that exam. And so the more of those kinds of things where students can kind of follow up and interact, we're using the technology to do the exam, so we have more time to do those kinds of things, and hopefully that also increases integrity.
Thank you, Mike. Really important. Unfortunately, we're out of time. We're just about at the end here. I really enjoyed the presentations and hearing from everybody and the questions and the answers. I just want to take a couple of minutes here and recognize our sponsors, thank our speakers again tonight. We had George Stacaro from the Copper Country Intermediate School District, Mike Meyer from Michigan Tech University, Marnie Polke and Pam Brown from Finlandia University. Our special guest tonight was Lydia from the Tech Tutors. We also had Cassie Munoz here, the director for the Center for Educational Outreach. So thank you for everything that you're doing for our students and staff, teachers, educators here at our universities and K-12 schools. We really appreciate everything that you're doing. One final time, I need to recognize our sponsors for tonight. Our presenting sponsor was UP Health System Portage. Our supporting sponsors include the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, and the Physiological Society. We really appreciate the support of our sponsors. I need to thank my co-host and colleague, Dr. Kelly Kam. I know you're doing an awful lot with contact tracing. Tonight we had a lot of good questions here, and we appreciate the updates with voting safely and also trick-or-treating coming up this week. Just to give you a preview for some topics that are coming up in the next couple of weeks. Remember, we're here every Thursday evening from 7 to 8 p.m. Next week, we're going to be talking about how to work safely and productively during the pandemic. So you can imagine that might involve working remotely or some type of online or hybrid. And then in a couple of weeks after that, or the week after that, we'll be focused on some of the student-oriented projects and how they're contributing to the COVID-19 response. If you did happen to miss any of tonight's town hall or our previous town halls, remember you can go to our website and download them. Our website is mtu.edu/health-research. Once you're on the top of the page, just remember to click on Town Hall. So with that, thank you to everybody working behind the scenes to help us put on the town hall platform. We will see you next week, Thursday, 7 p.m. Eastern. Have a great rest of your evening. Be safe and take care.